Keeping fit is also important to 77-year-old Bill Nerness. But 2 years ago, doctors found a spot on his liver. It was cancer. He went to see a surgeon at another hospital. It was an experience he will never forget.
He says, well, if I operate on you, you won't leave the hospital. He says, you got about 6 months to a year to live. Well, you know, my heart just dropped right out of me. I felt like dead man walking, you know, because, I mean, I didn't know what to do.
After the shock of hearing he had just a few months to live subsided a bit, Bill made the decision to come to Tri-City for treatment under the care of the chief of Tri-City's Interventional Radiology Department, Dr. Donald Ponec. Ponec performed 3 chemoembolizations, a procedure where he inserts a catheter inside the arteries that supply the tumor and delivers tiny, microscopic beads mixed with chemotherapy. These large doses of chemotherapy hit directly on the tumor, reducing it enough to be destroyed through another procedure called radioablation.
We did 3 procedures where we put those little beads into the tumor to shrink it, and it went from a fairly large tumor to a fairly small tumor, but still alive. The tumor cells were still there, only much smaller. The tumor overall was smaller. Then we worked with one of our surgeons, Dr. Deemer, and together Dr. Deemer gave us access to the tumor, and we had to remove the gallbladder at the same time. And then through that access site, we did the probe, placed the probe into the tumor, and then destroyed the remainder of the tumor cells. So we think, in Billy's case, this is equivalent to doing the surgery. It's hopefully curative for him. And it's a way that we leveraged 2 different types of new therapies to combine and get the same effect that you would have gotten from the big operation.
He put his arm on my shoulder. And I knew that he was serious about taking care of me. And that's the reason I'm here today, is because of him. So, you know, I've had nothing but good treatment here at Tri-City, and I don't ever intend to go anyplace else for my treatment of any kind. So, you know, that's my story, and I'm sticking to it.
Bill's continued good health more than 2 years after he was given mere months to live is a testament to the miraculous outcomes that occur every day at Tri-City. Dr. Ponec says the combined benefits of interventional radiology and the multidisciplinary approach at Tri-City, where doctors from various specialties collaborate on cases, often creates improved treatments for patients.
We sort of see this as the new way of doing things. It's like 21st century medicine, bringing together imaging and new techniques and new devices, in the future, new medications and even genomic materials and things that we think will be able to really expand treatments into areas where they really couldn't be delivered before. We have tremendously talented people, and there's a real sense of community and camaraderie, and the doctors really do work together, and you know, this case with Dr. Deemer was a great example of that. Tri-City is really unique in that way.
I'm going pretty good. Since that doctor told me I only had 6 months and a year, I've got him on both of them. Thanks to Dr. Ponec.
Tri-City Medical Center, taking the many threads of life and weaving them together with award-winning, nationally recognized medicine, compassionate care, advanced technology, and an unparalleled level of community involvement. Every day striving to improve the health and wellness of our community.